name is Emily Lester, and today I would like to talk to you about Tylenol. Imagine I've had a really stressful day at work. My head is pounding. Everything that could have gone wrong did. And there was construction going on outside my window all day. The jackhammer that was pounding outside is now pounding in my head. So I rush home, and what do I reach for? My Tylenol. My headache is so bad that I decide I'll just take an extra one. That couldn't hurt anything, right? Most people in the United States have used Tylenol at least one time in their life. If you've ever had a fever as a child, your mom gave you Tylenol. And most people take Tylenol for common aches and pains these days. Most doctors say Tylenol is the only safe pain reliever to take. You may not know this, but Tylenol can be just as addictive as any other pain medicine. We don't usually think of Tylenol addicts though. But people usually don't know the detrimental effects that abusing Tylenol can have. Today, I will inform you on the dangers of misusing Tylenol, also known as acetaminophen if you've ever bought the generic form, the symptoms of an overdose, and also how to safely use Tylenol. Acetaminophen was invented about 60 years before Tylenol was first marketed. Acetaminophen has been around for over 100 years. According to Wikipedia, the active substance of Tylenol, acetaminophen, was first used in medicine in 1894. Acetaminophen only gained widespread use after 1948, when scientists concluded that another popular drug, acetanilide, was toxic and that the same therapeutic effect could be more safely achieved with acetaminophen, which was already known to be a metabolite of acetanilide. Tylenol was first marketed in 1955 as a brand. According to Wikipedia, in 1955, McNeil Laboratories introduced Tylenol Elixir for children, which contained paracetamol as its active sole ingredient. It was originally marketed mainly towards children, but soon came to dominate the North American painkiller market. Now that you know the origins of Tylenol, also known as acetaminophen, let's explore the dangers of misusing it. Tylenol can cause liver damage if it is used incorrectly, either accidentally or on purpose. Liver damage occurs if you take too much of a medicine containing Tylenol. What many people don't realize is that many drugs that they take can contain Tylenol. For instance, Ultracet, which is prescription, Vicodin, which is prescription, or things like Tylenol PM, and many cold medicines also contain Tylenol. If you add that with more Tylenol, you're going to overdose. Your liver filters out the acetaminophen to clean your blood, and if you take too much acetaminophen, then your liver is overworked and can become damaged. If you take acetaminophen and drink alcoholic beverages, even sometimes a small amount, you can also overwork your liver because alcohol is also processed in the liver. Unfortunately, lots of people don't realize that they are taking several products containing Tylenol, and this is the most common cause of Tylenol toxicity. Sometimes taking a few extra Tylenol pills, which you think will work better, for instance, you take 3 instead of 2, can cause liver damage. And when in fact, 2 Tylenol pills will not work any better than 3 Tylenol pills. It is important to be able to recognize the signs of Tylenol toxicity to prevent severe damage to your liver. Some signs of liver damage are easily noticed, but can often be mistaken for flu-like symptoms. For instance, if you get nausea and vomiting, you might brush it off to flu-like symptoms, when in fact you could have Tylenol toxicity symptoms. But if your skin turns bright yellow, called jaundice, you're going to say, oh my goodness, I have a liver problem, and you'll probably go to the emergency room. If you do notice these symptoms, or you know you have overdose on Tylenol, you should go to the emergency room immediately to help prevent further damage to your liver. It is possible that you might not notice any damage to your liver, any symptoms, until it is too late. And if this happens, you could possibly require a liver transplant, or you could even die. Tylenol has recently come under scrutiny of the U.S. Food and Drug Administration because of the reports of liver damage due to the misuse of Tylenol. The Senior Medical Director of McNeil Consumer Affairs, the manufacturer of Tylenol, Dr. Edwin Kuffner, has issued a letter containing some of the following in response to the recent inquest of Tylenol by the FDA. What do some people need to know about acetaminophen and liver damage, he says. Tylenol, when taken as directed, remains the safest pain reliever people can take. It's important for people to know that it's not the recommended dosage of acetaminophen that poses the risk. Rather, it's when people take more than the recommended dose, either intentionally, often because they think it will work better, which is not the case, or unintentionally, often because they don't realize that several products they are taking at the same time, both prescription and over-the-counter, each contain acetaminophen. Now that you know the dangers of misusing Tylenol, let's look at how to use it safely. First and most importantly is to learn how to read the labels. Here's the label of Tylenol. The first thing you see on the label is the active ingredient. Make sure you're taking the drug that you know you're taking and that you know what extra ingredients might be in it. Acetaminophen 500 milligrams. This is Tylenol. You need to know what the uses are and only use it for the uses stated on the label. Also, know the warnings. In this one you see a specific alcohol warning. If you consume more than 3 alcoholic drinks every day, notify your doctor. Ask him if it's safe if you take Tylenol. There's other warnings as well. Know the directions. This is the most important. Do not take more than is directed. For this dose of Tylenol, you can take 2 caplets every 4 to 6 hours as needed. Do not take more than 8 caplets in 24 hours. Heed this advice and follow it. They don't print it for fun, they print it for your safety. Also, know the symptoms of Tylenol toxicity, which we have discussed. And also, Dr. Kuffner gives the following advice in his letter that we talked about earlier. Importantly, you can confidently take Tylenol according to the directions currently on the packages and can prevent inappropriate use by reading the label before each use and always following the directions. Never taking more than the recommended dose. Never using 2 products containing acetaminophen at the same time. Keeping out of the reach of children. Consulting a health professional with questions. The safety and efficacy of acetaminophen has been established through more than 50 years of clinical use and scientific investigation, and when it is used safely as directed. As you have heard, Tylenol can be dangerous if misused. Fortunately, if it is used safely, Tylenol can be one of the safest medications to take for pain relief. Reading and following the directions on the label is the key to keeping your liver safe.